Imagine taking an illegal substance and making that same substance an over-the-counter drug that people could legally buy as medicine. A substance that has gotten countless of individuals into trouble with the law and even placed in jail is now in the conversation to be legalized nationwide. My name is Alex Thompson, and my group members and I are here to inform you about the controversial topic of legalization of marijuana in the United States. There's a major divide in the nation's idea on what to do with marijuana. There are many different factors playing into whether legalization would be a positive or a negative addition into today's society. The goal for my group members and I are that we will be able to further educate you on the legalization of marijuana by talking about all these factors and informing you on the stakeholders. Our stakeholders are doctors, which Christine will talk about, cancer patients that Sydney's going to talk about, opioid addicts that Caitlin is going to talk about, recreational users that Clay is going to talk about, and local economy that Hannah is going to finish us off with. But I'm going to start by taking things into my own hand by talking about mental and physical health risks and benefits that come with cannabis. Marijuana, a chemically infused plant that has been connected to physical and mental health issues, is on the verge of legalization in most of the United States. The effects of marijuana on your body is dependent on different factors of the consumer, such as age and dosage. Two medical professionals by the names of Dr. Karen Lounsbury and Dr. Peter Jackson sat down to do a podcast with the University of Vermont Medical Center to talk about marijuana and how it affects our mind. When asked the question, what does cannabis do to our mind, Dr. Jackson replied that the cannabis plant contains over 400 different chemicals, and there are a lot of different cognitive effects after consumption. Different people's brains react to the chemical in marijuana differently. Due to different constituents in the plant, some people report feelings of euphoria and elevated mood. Some people find relaxation, other experiences more negative mental effects of cannabis. Those can include fear, paranoia, increased anxiety, and even psychotic symptoms. The consumption of marijuana in teenagers puts them at a higher risk of addiction to the chemicals because teenagers' brains and receptors are underdeveloped. Marijuana has been seen, though, to reduce anxiety and help cure mental illness, such as schizophrenia and PTSD. Different people's reactions from the plant are one of the main causes for the debate of legalization. Just like every other drug, marijuana works differently on different people, positively and negatively. Seeing how marijuana affects our mental state leaves you wondering how it will affect our physical bodies. In an article written by Dr. Brian Gray, describes what cannabis does to our bodies and how it affects our bodies. No matter how you consume the marijuana, it will affect almost every organ in your body one way or another. The article explains basically what in your body gets affected by the marijuana with an explanation of how it is being affected. Dr. Gray said that marijuana could help with pain relief and inflammation, nausea, and increased appetite. Cannabis has also been used to help cancer patients, but on the other hand, marijuana's negative effects can be memory problems, accelerated heartbeat, lung irritation, and a drop in immune system. After that, the article talks about what we don't know yet about how marijuana affects our bodies. Looking at how marijuana affects our body is extremely important because how it affects us is the whole point of the drug. The only question is whether or not people think the pros outweigh the cons. To see what medical professionals have to think about legalizing cannabis, Christine will tell you about her stakeholder, doctors.
Imagine you're in the drugstore looking for something to help you with your insomnia. You have many choices on the shelf like Benadryl, NyQuil, and Tylenol PM. Or you could go the natural route and buy some marijuana. A few years ago, that might have sounded ridiculous, but now marijuana is legal in many places. Among doctors, there's division over whether marijuana should be legal for recreational use for medical purpose only or not at all. One group pushing to legalize marijuana is the DFCR, or Doctors for Cannabis Regulation, a group with more than 50 doctors and faculty from several prestigious medical schools. More than 60% of the public also supports legalizing marijuana, with many feeling that it is no different than selling cigarettes or alcohol. The DFCR feels that legalizing it will reduce criminal activity. They also believe that regulating marijuana will increase the safe use of the drug. They argue that marijuana has minimal health consequences, which are not nearly as bad as criminal consequences. Making marijuana illegal doesn't really stop the use, it just creates a large black market with drug dealers who are often violent. There are hundreds of thousands of arrests each year, with some races and lower socioeconomic areas hit the hardest. This can be devastating to a community and otherwise innocent people. For a drug that many consider not harmful to your health, it's not worth the public harm that's caused by making it illegal. In the interest of public safety, the DFCR wants to legalize and regulate marijuana rather than dealing with the black market and the problems that creates. On the other end of the spectrum, the American Medical Association is opposed to legalizing marijuana and has been since 1937. The AMA and many individual doctors believe it is a dangerous drug that causes health problems. Some doctors argue that a legal medication is one that has been studied extensively, has gone through clinical trials, and has been approved by the FDA. None of these things have happened with marijuana. Also, frequent use of marijuana seriously affects short-term memory and compromises judgment of cognitive functions. Smoking marijuana can also cause lung damage. Many doctors fear that legalizing marijuana would lead to more use of the drug by many people and create bad health consequences. The AMA does encourage more research on the use of medical marijuana, but they can't support doctors endorsing a drug that they feel is harmful to the public. While AMA as an organization does not support legalizing marijuana, many individual doctors support legalizing it for medical purposes only. Nearly 90% of the public agrees that doctors should be able to prescribe marijuana. Studies have shown that marijuana can ease pain and nausea in patients with illnesses such as cancer, multiple sclerosis, and AIDS. It can also relieve anxiety, depression, and insomnia. There is a low potential for abuse and few side effects. Marijuana is less toxic than many other medications, and the risk of dependence is no worse than with caffeine. For these reasons, many doctors want marijuana to become legal for medical purposes so they can prescribe it for patients who could benefit. Doctors continue to debate whether marijuana should be legal. Some feel it is dangerous and should be illegal, and others don't feel that it is harmful at all. They argue that the public consequences of a black market are worse than the drug itself. Still, others fall into the middle of the debate and want to see marijuana legal for medical purposes. You might want to check your local Walgreens. Someday soon, you might just find marijuana next to the antihistamines. When talking about how cancer patients use medical marijuana, we never actually think about the process they have to go through when acquiring the marijuana. In an interview with cannabis specialist Dr. Tischler, he advises that when cancer patients make the decision to use medical marijuana, they need to consider health factors and what we know about efficiency, as well as consult with a cannabis specialist and their oncology team. Although medical marijuana is moving towards being legalized in many states, the lack of research is slowing down the legalization process. Many cancer patients and physicians struggle with the decision to use or prescribe medical marijuana. This is because there are many potential benefits, but there are also risks for cancer patients using marijuana. While there is not enough concrete research to clearly state the benefits and risks of medical marijuana, an article titled "The Use of Medical Marijuana in Cancer," published in the Current Oncology Reports, states some potential benefits and risks. While there are many symptoms that can come along with cancer patients, specifically, cancer patients undergoing chemotherapy tend to benefit from medical marijuana in the aspects of nausea and vomiting, pain, and appetite and weight loss. And there has also been talk about long-term risks that could be associated with smoked marijuana. When cancer patients are deciding to use marijuana, they will have to realize that while there are potential benefits that could greatly improve their symptoms, the research about potential risks is not clear, and those risks could outweigh the benefits. Cancer patients need to understand the difference between inhaling marijuana and choosing to use edible marijuana. In the interview with Dr. Tischler, he stresses the importance of inhale versus oral, meaning smoking marijuana or orally ingesting it using edibles. When addressing inhaling the marijuana, Dr. Tischler says, "I don't recommend people smoke because obviously any exposure to smoke is not good for you. On the contrary, the advantages to inhaling marijuana are important to understand. Oral marijuana products are modest in duration, whereas inhaling marijuana is the opposite. It is important for us to understand all the things cancer patients have to consider because most people think medical marijuana is solely beneficial for cancer symptoms. However, many other factors come into play." The legal status of marijuana allows little to no studies to be done on the benefits and risks the substance has on cancer patients. Cancer patients are unable to fully make a medically safe decision regarding the use of medical marijuana because the legal status it has in many states in the United States. While it is continually made clear that there is limited evidence regarding the risks and benefits of medical marijuana, the article titled "The Use of Medical Marijuana and Cancer" states that there is potential for therapeutic applications in oncology. However, when continuing to study the effects, legal status in the United States presents challenges to research. In the states in the United States where medical marijuana is legalized, physicians are required to only prescribe medical marijuana to patients with a qualifying diagnosis, which means it can be seen that the potential benefits for medical marijuana outweigh the risks of medical marijuana. This article concludes with saying medical marijuana may have use in cancer care, but there is more research necessary to better inform patients and physicians about the risks and benefits. The struggle of prescribing medical marijuana to cancer patients in pain will continue until medical marijuana is legalized and able to be studied the way it needs to be studied. People need to take a step back and consider how many people could benefit from medical marijuana and realize it could potentially help the medical world in the long run. The problem with medical marijuana and cancer patients is the lack of research, and legalizing medical marijuana would allow studies to be done on cancer patients to see how it could benefit and how it could put them at risk. Now Caitlin will speak about the use of marijuana with addicts.
Hi, my name is Caitlin Marzette, and in today's episode, I will be talking with you about medical marijuana and how it can possibly help with addicts. The main question of my section of the podcast is, can medical marijuana help with opioid addicts? I'm not sure if you know, but the opioid epidemic in Kentucky has skyrocketed in the past 5 years. According to the Office of Drug Control Policy, in 2017, a total of 1,468 people died from an overdose, and that was just in Kentucky. The legalization of marijuana can help with weaning opioid addicts off their drug and help lower the overdose rate across Kentucky. So why don't we start by looking at an interview conducted by CNN on Dr. Gupta. Dr. Gupta is someone who has dedicated his years in the medical field to figuring out the best way to stop this opioid epidemic. 115 Americans die a day from opioid overdose. That's more than car accidents, breast cancer, or guns. Paragraph 4. This epidemic has been named the worst self-inflicted epidemic in the history of our country. Quote Gupta. This is crazy to think, but the drug overdose scourge claimed about 68,000 lives in the U.S. in 2017, and just over 45,000 of them were from opioids alone. Dr. Sanjay Gupta also states that cannabis can show potential to save lives in 3 ways. Para 8. According to Gupta, the cannabis can help treat pain and in return terminating the need to use opioids in the first place. Cannabis can also help ease the pain of opioid withdrawals and make them more bearable, stopping the need and or want of the initial opioid. Para 8. Also stated in paragraph 8 by Dr. Gupta, the compounds found in cannabis can even heal the addict's diseased brains, helping them break from this terrible cycle. Now, while all of this sounds great, the only bad thing is we don't have funds to research. In an interview that I conducted with a psychology professor At the University of Kentucky, Ms. Christina Patterson stated that medical marijuana can definitely help with several medical problems. Just as researchers, they don't have enough funds to prove this. She even stated that it is easier to do medical research with cocaine rather than medical marijuana. The THC that comes from marijuana, which is the compound that releases the dopamine in your brain that causes the high feeling, can also offset the damage that addictive brains have. With that being said, this just shows that medical marijuana can be a way to help these addicts off their drugs and onto something more safe, and this can be a way to help the death rates due to overdoses be lowered. Now, living with an addict isn't easy. They'll do whatever they feel they need to do to get their drugs. Doesn't matter if that involves stealing money, stealing PlayStation, or taking jewelry to sell at the pawn shop. Being an addict isn't easy either. My brother was 21 years old when he passed away from a drug overdose. I watched him struggle with his addiction for 5 years. Within those 5 years, he attended 4 different rehabs and had 2 prior overdoses before actually passing away. Rehabs help, but he was always able to find his way back to the pills as soon as he got out. Having medical marijuana be legalized can be a way to help these addicts get off their drug and not find another more harsher, even worse drug to get addicted to. My brother's body was so used to having the pills in his system to the point that he couldn't even eat because the withdrawals were so terrible. Medical marijuana has been proven to help with the withdrawal side effects. I feel as if medical marijuana is possibly the new way for medicine. If it can help with the lower addict rate and overdose rate, I wonder what else it can do for our economy.
Hey guys, my name is Hannah Darty, and while I was researching the topic of marijuana legalization, I found myself most interested in the types of economic solutions that it may or may not provide. The first thing I was interested in was our state's debt. With all of the pension bills and the budget cuts lately, I did a little searching and found Kentucky's debt clock online, and I was blown away. I knew that it was bad, but you've got to check this out for yourselves. You will see astronomical numbers that have accumulated over the past decade alone. Kentucky is currently facing a debt of $37.6 billion. But with the legalization of marijuana, those numbers can be greatly decreased, if not abolished. For this episode, we're going to focus in and look at the economy at the state level. Let's start with Colorado. In 2010, Colorado was in a debt that exceeded $50 billion, almost double Kentucky's debt. According to Allison Felix, VP and Denver branch executive at Federal Reserve Bank, Colorado legalized marijuana in 2012. And quote, within the first month of marijuana stores opening in Colorado, recreational sales exceeded $14 million, and medical sales more than doubled that amount at $32.5 million, unquote. That was just 1 month. By 2017, recreational sales had grown to almost $1.1 billion, and medical sales were almost $417 million. In 2017, combined marijuana sales in Colorado exceeded $1.5 billion. Now, I know we're talking about lots of big numbers and lots of money, so just hang in there with me. To put the magnitude of marijuana sales in perspective, personal consumption spent on all goods and services totaled $236.3 billion over the first 5 years of legalization in Colorado. Now let's take a look at Kentucky. Kentucky has not legalized marijuana, but with our $37 billion debt, our government is starting to look at some new options.
With the pension crisis and economic demand for more money, House Bill 136 is making some progress. And next to gambling, marijuana seems to be a feasible option. Now, if we just use Colorado's example and follow in their footsteps, $236.3 billion in 5 years puts Kentucky well out of debt in only 2 years. The economic benefits are clear. Increased tax revenue to the state, decreased cost of criminalization, hundreds of new jobs, increased tourism, and more. Hundreds of millions of dollars either made or saved from legalizing marijuana could be used to increase school budgets, build roads, fund pensions, and more without raising or creating new taxes for our citizens. So, to answer the age-old question, maybe money can grow on trees.
Hi, my name is Clay Fitzhugh, and I'll be sharing with you the position recreational marijuana users stand on the legalization of marijuana in the United States. For a few years now, there's been a sudden push to legalize marijuana for use in the medical field. The reason for this is because marijuana can help reduce pain in patients who are struggling with painful illnesses, or can improve the appetite of patients who have an eating disorder or refuse to eat due to treatment. Many states in the U.S. have legalized the use of medical marijuana, but today we are seeing more places also legalize the use of recreational marijuana. Many conservative states refuse to pass legal marijuana laws today, whether they believe it will become legal eventually or not. Marijuana is often thought to be safer than alcohol and can provide large sums of money to the state if sold legally. Marijuana can indeed provide a good deal of money to the state if legalized and sold to the public. Look at Canada. They are the second country to legalize recreational marijuana after Uruguay, and it has greatly improved their economy. Legalizing recreational marijuana caused Canadian tourism to boom. By considering this, it is projected to be a $5 billion industry by 2020, according to the New York Times. Canada's National Statistics Office said that 4.9 million Canadians used cannabis last year and consumed more than 20 grams of marijuana per person. The statistics here can be compared to a study ran by Yahoo News and Marist University, which said about 35 million people in the United States regularly used marijuana. Just this year, according to CNBC, Colorado topped its profits from marijuana to $6 billion due to the legalization of selling it for recreational use. These statistics are proof that there is a large market for recreational marijuana in the United States as a whole. Although there is not enough research done on marijuana due to the fact that it is illegal, these numbers still apply and portray the demand for marijuana all over the country. Marijuana is safer and less of a risk than alcohol. According to NBC News, new studies have shown that marijuana is safer than alcohol or other recreational drugs. It is non-addictive, and there has never been a death recorded that has been solely caused by using marijuana. While these statistics are true, marijuana can still be dangerous. According to the New York Times, using marijuana at a young age can cause slower development and can cause significant mental health issues if used by the wrong people. These dangers are moderated by requiring customers to be over the age of 21 years old when purchasing marijuana. With these studies now on the surface, marijuana can be seen as a safer substitute for alcohol in many cases. Although, when it comes to driving under the influence, we are not sure how being high can truly affect one's ability to operate a vehicle. On the flip side, though, we do know that driving under the influence of alcohol is very dangerous and causes the deaths of many people each year. Marijuana can be compared to alcohol in many different ways, but as of right now, there is no definite answer on how much better using marijuana is than alcohol, because there is simply not enough conducted research on the substance.
Alright, so what do y'all think?
After researching cancer patients, when it comes to legalizing marijuana in all states, and I think the U.S. should start with legalizing marijuana just for cancer research. We need to become educated about the topic before making it legal throughout the United States. After researching cancer patients and marijuana and listening to Clay's episode about recreational use, cancer patients seem like the ones of high importance when it comes to using marijuana. We need to be able to research how marijuana affects medical patients, because right now we are struggling to know the risks that could be potentially make medical patients get worse. In my opinion, the United States should start by legalizing marijuana for medical research and eventually work towards legalizing marijuana in general.
I agree with you. Research costs money, and while I was researching marijuana and looking at the economic effects, hundreds of millions of dollars can be made or saved from legalizing marijuana and could increase school budgets, build roads, and fund pensions, while also creating new jobs and helping the economy.
I agree. After looking at my research done on recreational marijuana users and all of the research done by each group member, legalizing marijuana would in fact benefit the economy and the quality of life in the United States. Many people already use marijuana all over the United States, even if it is illegal in the state they reside in, especially because marijuana is scientifically proven to be less harmful than alcohol, which is legal in the United States, and it can reduce the pain and suffering endured by cancer patients and other sick people. I see no downside to legalizing the medical and recreational use of marijuana in the United States.
I agree with Sydney. I think based on my source, doctors, marijuana should be legalized for medical marijuana only. I do think it needs to be researched way more before giving it to patients who are already in bad health, such as cancer patients. The only problem with this is that it is illegal, so it is hard to research. I don't think it should be legalized for recreational use because it is a drug that affects your short-term memory and other health reasons. But if it benefits a patient and there is research on marijuana, I think it should be legal for doctors to prescribe.
I feel as if the sole purpose of medical marijuana right now should be more in-depth research. Researchers don't have enough funding from the government to do real research on medical marijuana. As stated in my episode, my interviewee, Christina Patterson, said, "It is easier to do medical research with cocaine." My stakeholder was opioid addicts, and while I was researching this stakeholder, many things came up on how medical marijuana can help and how many researchers want to find facts on medical marijuana. They just can't because of funding. In the end, I agree with Sydney, and I feel as if medical marijuana should be legalized for research. And once we learn more about the effects, then we can apply its benefits to other things.
Yeah, I definitely agree that marijuana should be legalized in the United States. And I agree with all the stakeholders that my group members and I talked about in the podcast. I think that the medical benefits of marijuana would be very helpful for chronic pains and mental health and eating disorders and things like that. Marijuana can also help swing struggling opioid addicts away from their addiction, like Kaylin was explaining, which is obviously very helpful with, helping drug addicts and things that are out of their control. Legalizing marijuana will also free up a bunch of jail space for petty charges and possession charges, and that would also give a lot of money back to the states and the government and to people.
All of our group members ended up agreeing with their stakeholders based on the research that we conducted.
Thank you for listening.